Dear viewers, as you know, the health is a special gift from Allah subhanahu wa ta'ala, and some rules and precautions are necessary for good health. In this fast paced life, if we listen carefully to the instructions of health experts and follow them, then surely we can live a healthy and safe life. I'm once again very happy and very pleased and give you this good news that once again, on the immense request of all of us, we have requested Dr. Anthony Leeds to start a program of awareness and understanding of disease facing human health, for which Professor Anthony, despite his extremely busy schedule, has started Series 5 to fulfill the desire of all of us, for which we welcome and thank you, Dr. Anthony Leeds, on behalf of the
Thank
organizers and Southern Awaz, Toronto, and all the staff who helped in this recording. As always, the purpose of having a brief introductory conversation at the beginning of the series is to provide some information about the upcoming series to interest our viewers. Dear Professor, we begin our short program with this first question. I hope you are ready to give the answer to all questions.
Yes.
Do we know from audience feedback what are the topics that viewers wish to learn about?
Well, first of all, thank you very much indeed for asking me to prepare another series of these programs. And obviously, I'm delighted that you have such a large audience. We know that well over 2 million people actually watch the programs. And you and I have sat down and done some analysis of the figures that we've been given. So we do know a great deal about where the viewers are and how long they watch for. But you also know from email letters that have been sent to you, they've made requests about the topics that are of particular interest. And for example, they said that they very much enjoyed listening to Mr. Pratik Sufi, who's the bariatric surgeon, who did 2 programs in the last series. And he, of course, in those 2 programs ran through a description of bariatric surgery and described the effects of it and the benefits of it. And obviously the audience was very impressed. Over 2 million people watched both programs, and they have asked that he speak again, and I'm delighted to tell you that he's accepted our invitation. He was very pleased to be invited again, and his program will appear in probably about 2 or 3 weeks' time.
Do you have a guest to cover these topics, Dr. Anthony?
Yes, so in addition to bariatric surgery, we know that people were particularly interested in the programs on dementia. So obviously, I'm still making some of the arrangements towards the end of the series, but I'm hoping that we will have somebody to talk again a little bit more extensively about dementia. I should, however, remind viewers that for each of the programs, I do provide some text, some written text, which goes underneath the video. So anybody who's not looked at those may care to look at those. And in addition to the comments that I've written, I've also provided some web links to sources of information. So, for example, for the dementia programs that were shown last year, underneath people will find the links. I'll provide these again when the program comes. And those, I do hope, are of use to people and help people to be directed in the right direction to gain the help or the information that they would like.
Do we know in which countries viewers are resident?
The majority of the audience is located in South Asia, Pakistan, India, Bangladesh, and we know that we know also from the actual duration of the period of watching the program that the behavior is very typical of individuals who watch videos online. So, as you know, and as everybody knows, when somebody clicks on a program, they watch for a few moments and decide whether or not they want to continue. So those first few moments are quite important. And then, of course, you can gain figures for how many people watch for 5 minutes, 10 minutes, 15 minutes. And obviously the people who are not particularly interested come out of the program in less than 5 minutes. Once, interestingly, what we found, and you and I looked at these figures, we have seen that once people have gone beyond 5 minutes, the majority then stay with the program for at least another 15 minutes, taking them through to 20 minutes. I find that absolutely fascinating, because I find it quite extraordinary that individuals are prepared to stay and listen, and I do hope that that's a reflection of the fact that the programs are of interest and that the speakers are holding the attention and the imagination of the viewers, which is what must be happening. And then indeed a good proportion go on to watch the entire program, most going on for about 23 to 25 minutes. So this, I think, is really extremely good. In addition to the information that's provided under the video window, there is text. We haven't previously put very much on the screen in terms of diagrams or information, but I think we may put a little bit of information right at the very end in addition to the information under the screen for this series. We'll see what we can do about that. But we do know a great deal about the audience now. We know where they're located. We know that 50% of those who watch beyond 5 minutes are from South Asia.
Yes.
20%, the further 20% are from China and Taiwan and Hong Kong, so East Asia. And then the remaining 30% are distributed through North America, through Europe, and then small numbers. You know, and now why is that important? Well, it is important because what I try to do is to provide links to the authoritative websites in the countries where the viewers are located. Now, of course, sometimes there isn't a suitable source that I can find, but in other cases you might have to look, for example, at a US or a United Kingdom websites to gain information. But for example, for diabetes risk, there are quite a lot of good websites with good tools on them that enable people to assess their risk. But of course, with the international access to all the various websites around the world, you don't necessarily need to look at one for your country, although it's very important to recognize that it is better if the experts in a given country have actually prepared something for you specially. And so there's a variety of information, and I try to provide as much as I can.
Why is it important to know about the global audience and how they like to watch?
Well, I think, and I have to say, this is the first time that I've ever actually looked in detail at the behavior of audiences, and I am very interested in the way that this is happening, and it actually gives me clues about the instructions I will give the guests. So, for example, if we know that, obviously, as you'd expect, the numbers actually go down very slightly and steadily from 5 minutes to 20 minutes. It's probably quite important for us to give the key messages right at the beginning, and for me also to draw attention to the fact that there is additional material just under the video screen, and therefore anybody who hasn't got the time at that moment to continue to watch knows that when they go back to it, they will find that useful information, and also they've already received the key messages. So in effect, rather than do what one normally does, which is to summarize at the end, what we really have to do is summarize at the beginning, then go into the discussion, summarize again, and remind everybody that there is information underneath the videos.
Well, finally, very interesting question to you. Do you have any topic that is completely new and surprising?
Well, this is interesting because, again, you and I have had long conversations about the way in which people in the different sections of the media are interested in reporting news, and they have a tendency quite often to report negative news, and they aren't always interested in something that's old, even though it's very important, and perhaps the old news is more truthful than the new news. But what is interesting is that I am able to tell you that in the program that will follow this, all being well, Professor Mike Lean will describe for you the first publication in a piece of work in which they have looked in Glasgow at people with long COVID, which globally is a problem for those who've had a COVID infection and where their symptoms have not gone away. And this is actually a cause of depression, anxiety, physical fatigue, and so on, and also is a cause of not feeling able to go back to work. Now, here in the United Kingdom, and I do know also in other European countries, there are problems with having a higher number of people who are now signed out of work because of their long COVID symptoms. And what is really exciting, I don't want to preempt the exciting information that he's going to give you next week, but what he's done is, what he and his colleagues, and I should say it's always a large team of people working on this, what they've actually done is to use the same intervention that was used for achieving diabetes remission. And you'll recall that in the last series, he described the very good results that are obtained by helping people to lose 10 to 15 kilograms in weight, bearing in mind that a good majority of people in many countries are heavier than they need to be. And the effect of that weight loss, of course, in those who have early diabetes is to put them in remission. Now, it wouldn't necessarily follow that doing the same thing would be of benefit in other situations. However, we do know from all our other work that it lowers blood pressure, it improves markers of inflammation. That's very important, for example, in long COVID. And I think I'm not going to tell you what the final outcome is, because I would ask you to watch the program next week. But what I can say to you is this is, in my opinion, the most exciting paper that I have read in the last year, and I think its significance globally for the global problem of long COVID will be very important. So do watch the first program in my interviews with guests, starting with Professor Mike Lean from the University of Glasgow next week.
Professor, once again, thank you very much for your precious time. And we request the viewers to give us your feedback after watching the programs to improve it further, so that we can use your suggestions your suggestions always oxygen for us. Viewers, I would also like to share the good news with you that you can watch our program with subtitle in your desired language to fully benefit from it. Please also send the link of this program to all the friends, relatives, and loved ones. It is possible that the link you send may lead to the better health for a sick person, and we too may be entitled to praise along with you. Take care and goodbye.
Thank you.